Hello guys, hope you all are doing well. Today we will discuss about the important issue, and our topic is about the side effects of paracetamol. Paracetamol, also known as acetaminophen, is a widely used over-the-counter analgesic pain reliever. Here are some common side effects, affecting up to 10% of users. 1. Nausea and vomiting. Mild stomach upset, nausea, and vomiting. 2. Headache. Mild to moderate headaches. 3. Dizziness, lightheadedness, or dizziness. 4. Sleep disturbances, insomnia, or vivid dreams. 5. Rash, mild skin rash, or itching. Now we discuss about the rare side effects affecting up to 1% of users. 1. Allergic reactions. Severe allergic reactions, such as anaphylaxis. 2. Blood disorders, rare blood disorders such as thrombocytopenia or agranulocytosis. 3. Liver damage, rare cases of liver damage or liver failure. 4. Kidney damage, rare cases of kidney damage or kidney failure. 5. Stevens-Johnson syndrome, rare skin and mucous membrane disorders. There are some rare side effects affecting less than 1% of users. 1. Toxic epidermal necrolysis, rare skin condition that can be life-threatening. 2. Angioedema, rare condition that causes swelling of the face, lips, tongue, or throat. There are some long-term side effects as well, like 1. Liver damage of high doses can cause liver damage. 2. Kidney damage. Long-term use of high doses can cause kidney damage. Interactions with other medications. 1. Warfarin, paracetamol, can increase the risk of bleeding when taken with warfarin. 2. Anticonvulsants, paracetamol, can increase the risk of seizures when taken with anticonvulsants. 3. Antidepressants, paracetamol, can increase the risk of serotonin syndrome when taken with certain antidepressants. I will also discuss about precautions. 1. Liver or kidney disease, used with caution in patients with liver or kidney disease. 2. Pregnancy and breastfeeding, used with caution in pregnant or breastfeeding women. 3. Alcohol consumption. Avoid consuming alcohol while taking paracetamol. That's it for today's video. We hope you found this explanation helpful. Remember to always follow the recommended dosage and consult your doctor if you have any questions or concerns. Thanks for watching, and we'll see you in the next video.